You're watching CT Live on NBC Connecticut.
Welcome back. Well, it is so important to establish good gynecological care, but when should you start seeing an OBGYN? I sat down with Dr. Jamie Benway from Women's Health Connecticut to learn more.
Women's Health Connecticut is the largest OBGYN physician practice in the region and solely focused on women.
So there are a lot of different age ranges that we'll start to see teens. So some women, we're seeing them earlier if they're having concerns with periods or problems with their periods. Other teens we're seeing later if they're becoming sexually active or planning to become sexually active. And then some people we're just seeing for routine gynecology care without any real concerns.
Tell me what a typical visit looks like for this age group and how is it different than a regular adult visit?
In the teen years, we're really assessing, is a pelvic exam needed or is it not? I think a lot of the anxiety around that first gynecology exam has to do with the visit and knowing that some people really don't need that visit. If a woman is not sexually active or if they are not having any real concerns within the pelvis, then it might not be an exam until later in life. But if it is time for that exam, we really try to make sure at Women's Health Connecticut that we're explaining things well and having patients take part in their care so they really understand what we're doing and why.
I can imagine that many in this age group are incredibly nervous about their first visit. So how do you ease their fear of this first appointment?
We try to really walk them through each thing we're doing and why. I think a lot of education about why we're doing certain parts of the exam does take a lot of those fears and away. So explaining why we're doing speculum exams, different parts of the pelvic exam or breast exam kind of empowers people to know why we're doing those things.
Who refers them to you?
So sometimes it can be from a pediatrician. A lot of early or easy gynecology issues, pediatricians may feel comfortable with. But if things are more complex, then sometimes they'll send them on to us. Other times we're seeing, generational patients, so the teens of our own patients at Women's Health Connecticut or siblings. And then finally it could just be a patient referring themselves because they know it's time to come in for that gynecology care.
What are some of the important things that the teens should know that would prompt them to make an appointment?
Specifically, we're looking usually at issues around periods. That can be a big problem in our teen years. So whether that's problems with the bleeding themselves, whether it's problems with cramping, or even PMS symptoms around the time of periods. Other people are really having, no issues but planning to become sexually active, and they want to be, more prepared for sex, have a safer sex plan in place, whether that's talking about condoms or going through all the different birth control options to decide which might be best for them.
What types of screenings do you do during that first visit?
So depending on whether or not someone is sexually active, we may talk to them about STD screening. That doesn't always have to be done with a pelvic exam if someone doesn't feel quite ready. So that also can be done through urine testing. If someone is 21 and sexually active, we'll also talk about pap smear screening. So pap smear screening is a test looking for precancerous or cancerous cells of the cervix caused by HPV. Getting HPV or the human papillomavirus can be very common, but it's making sure if they do have it that they're able to fight it back off.
You mentioned not needing a pelvic exam until you are sexually active. For those who are, what do they need to know?
So really this is where we often use a lot of diagrams and explanation to really show what this pelvic exam is looking for. So often things like infections, whether that's STDs, like gonorrhea, chlamydia, or HPV, live at the cervix. Because the cervix is within the body, that's where we use different ways to actually get to the cervix to do that testing. And that's kind of what that pelvic exam entails. We're also taking a feel over the uterus and ovaries to check for things like fibroids, polyps, or pelvic pain. So that's really what the exam entails.
What are some of the personal touches beyond the OBGYN side of things that you offer here at Women's Health Connecticut?
So I do think we really try to put a lot into this education. I think having a good foundation for your gynecology care as a teen does set you up for much better care in the future. And by taking away some of that fear, I think it makes women much more likely to come back in for future visits. We also do really try to focus on care and compassion to make sure people feel heard and know that we're really addressing their concerns.
Women's Health Connecticut provides comprehensive OBGYN care and compassionate support as you navigate through each stage of your life.